So the PCOS market is a unique market within women's health. We don't have a clear solution for this condition. There are a lot of band-aids. There are a lot of different therapies that women use during their experience of PCOS at different phases and for different symptoms. It's really remarkable that a condition that affects 1 in 10 women, 10% of women of reproductive age, has no holistic solution. Therefore, it's very hard to benchmark exactly how big the market is. But of course, in the silver lining on that cloud is that when there are no solutions, the space is wide open. So there's so much room for innovation, right? And I think we've seen in recent years, there's been more efforts to target PCOS, both from a therapeutic standpoint, from a device standpoint. So that right there, even though we don't have necessarily a benchmark of a current solution that we're trying to take market share from, there's still so much demand that's untapped, an opportunity for us to further segment those patients, further understand the unique needs within that huge group, and to bring solutions to the table for these women. So bringing a solution to market, you can make a huge impact and reach a lot of women quickly because you can offer something truly differentiated. So here at May Health, we have developed the ovarian rebalancing procedure, which is a new approach to ovarian ablation, which avoids laparoscopic surgery, enables the delivery of ablation to the ovary through a transvaginal ultrasound guided route. And this is a new approach designed to make the procedure less invasive to women, avoiding laparoscopy, easier for physicians to implement in their workflow because it can be done in the office in a one-day procedure. And it's designed to restore ovulation for women who are anovulatory due to PCOS. Today, our first focus is looking at fertility. Women who have PCOS-related infertility start with first-line oral ovulation induction drugs, and then eventually move on to IVF. And what we see is that there's an incredible dropout of patients through that process. So what we're endeavoring to do is offer a solution for women who don't want to or don't have the means to go all the way through to IVF, who want to have a procedure that can allow them to restore ovulation, which should enable the ability to conceive ideally at home without hormone injections, on their own. Fertility represents a great beachhead market for us and an important first indication, partially because it's a well-established pain point for women who are struggling with PCOS, also because it's a very clear and binary marker that we can use as a primary endpoint in terms of reestablishing ovulation and achieving pregnancy as a secondary endpoint. However, the metabolic impact of PCOS is broad and lifelong, and we do hope to have an impact across a woman's entire experience with PCOS. We have a very broad set of secondary endpoints in our pivotal study that we're running today, and we are running that study for 3 years. So we'll follow women for full 3 years, looking at, of course, ovulation and pregnancy, as well as all sorts of outcomes around pregnancy, live birth, pregnancy complications, etc. Then we'll also look at hormone levels, including LH, FSH, testosterone, AMH, through the 3-year period at regular intervals. We're also looking at cardiovascular markers, insulin resistance, HbA1c, and then we're also looking at some of the symptoms that really impact women personally that they care significantly about, such as hirsutism, acne, and quality of life. And so as we look at all those secondary endpoints in 150 patients over 3 years, we hope to see some trends of improvement that tell us where we can dive deeper. We absolutely plan to continue to develop clinical evidence around the opportunity for the procedure to impact the broader metabolic impact of PCOS.